We can't take any chances. We can't loosen any of the measures. We have to continue doing what we have to do correctly, and that means staying at home as much as possible. For the equipment, we now have for 14 days of gloves, 13 days of N95 masks, 10 days of surgical masks, and 6 days worth only of gowns. So as you can see, our efforts are a lot on the gowns right now. We are looking at the possibility of using washable gowns more. That already exists in hospitals. Of course, it would allow us to reuse those gowns. And we're working very hard still, and I talk about it every morning with Quebec companies that are trying to get material out to us. But it's going to take a few weeks yet to be able to get to that. A word on pregnant women. We know that right now there's only one hospital that does not allow having someone with women who are coming to give birth. That's the Jewish hospital. So we're having a look at things for women who want to change hospitals so that they are able to change hospital. But at the General Jewish Hospital, there are a lot of cases of COVID-19, so there are good reasons why this rule exists. But I want to be very clear. There is no intention on the part of the government of extending these bans to any other hospital. So I want to reassure all women who are pregnant right now, apart from the Jewish hospital, you will be able to bring your partner with you when you give birth. Yesterday, I talked to you about Quebec companies. This afternoon, Jean Boulet, the Minister of Employment and Labour, is going to make an announcement of $100 million to help those companies that could take advantage of the present situation to do training for their employees. I think that this is the ideal moment, taking into account that work in a lot of businesses is on hold. I think, doing training, amongst others, all the training on working from home, everything that's digital. Of course, things will be changing a lot in the next few months, and so we are going to, the government, with this program, pay up to 100% of both wages and expenses, which will allow us first to prepare ourselves to the reorganization of labor, but also to keep more employees who will continue being paid with their wages. So I think that this is a really nice program. And of course, training in a knowledge-based economy is very important and will become even more so. My daily thanks are going to be for Quebecers as a whole. We saw yesterday that Quebecers are those who have responded the best in North America to the guidelines. I think that it's beautiful to see, on the one hand, people who are not in essential services who stay at home, and on the other hand as well, it's beautiful to see, and I get all sorts of testimonies as well in our hospitals and grocery stores, police officers, even in banks, cashiers, everybody is doing their job and is getting through this crisis. And I want to tell you that I'm so proud of the Quebec people. I would like to end by repeating our 3 priorities and by specifying that if we respect these 3 guidelines, we are saving lives. So this is something that is important. It is not anything that is banal. So if you don't leave your home, if when you do go out, you always stay 2 meters away or 6 feet away from other people, and when you come back home, very important, wash your hands with soap. So I count on you all, and I feel like saying, too, in April, let's not loosen any thread. Let's keep it all tight. We hope that it's going to be the last difficult month, but the month of April will be critical. The following days, the following weeks are going to be critical. We're going to remember this month of April for a long time. But let's not loosen, let's not slacken things during the month of April. English.
We may see the light at the end of the tunnel, But we must continue to do everything we can to win the battle against the virus. We must also prepare the restart of our economy. Our Minister of Labour, Jean Boulet, later this afternoon will announce a new program that will help companies train their employees to new technologies, to new organization. And I repeat my three priorities: to protect ourselves, don't go out unless it's necessary. If you do go out, keep your distances, and when you come back home, wash your hands. That's how we'll save lives. Thank you.
Merci, Monsieur le Premier ministre.
Thank you, Mr. Premier. We will start the question period.
Monsieur Arruda. Ma première question est pour vous, Monsieur.
My first question for you, Mr. Arruda. You've probably seen a few minutes ago, Dr. Tam for Health Canada now recommends the wearing of non-medical masks for the population, not to protect oneself, but to make it that people who are asymptomatic or pre-symptomatic be able to limit the spread of the virus. This from Canada's Chief Public Health Officer, Dr. Tam. What do you think about this? I have the same position. I am the Minister or the National Director of Public Health of Quebec, and with my different counterparts. The difference is that today we said it can be a means, and I did write up that it's still a draft, for interprovincial purposes. But what is said in the document, and I find it really important, what is proven is to stay home as much as possible. Having physical distance, as we remind people every time, wash your hands, protect the most vulnerable from infection by not visiting them, etc., and to covering one's mouth with fabric or one's sleeve. In fact, what is very important is that procedural masks must remain for health workers. What is indicated here is that in no way does wearing a mask that is homemade should replace any other measure. If people do that, they are not going to be protecting themselves. The mask that you wear that, it has to be well adjusted, it has to be washed regularly, for which you have to decrease contact with the eyes or the mouth. That can be used, but only to protect others from ourselves if we are sick. That's exactly what I said. It's exactly as if you were coughing into a Kleenex and then you have to wash your hands. So what is said today is that in certain situations where physical distancing is not possible, at the grocery store, in public transportation, well, if you are ill, rather than coughing like this, you can wear a mask as such, but knowing you're not protecting yourself if you do that. You're protecting others. And it is very well written here that you have to be very careful when you wear it. You really have to feel that it prevents you from touching your mouth or eyes with your hands, which is not usually the case. You try to see people wear it like this and then they put it back on. Do not share a mask. When it is soiled, you have to throw it away. You can contaminate yourself when you remove it. So it's the same position. The only thing that is said here is that it can become an instrument for those who are ill, who rather than coughing in their Kleenex will do that. And that's exactly the way it's written here. And I proved it this morning, how it is written here, which is not going against what we said. It just gives more details. The danger is that the other elements of hygiene be let aside and that people might think that they're protecting themselves with a homemade fabric mask. It has to be really well adjusted to the face, worn in the right place, well adjusted, and especially, most particularly, if it somehow increases contact between the hands and the face, well, you've completely obliterated the positive effects. But if you cough while wearing that mask, well, of course, you're sending less elements out there. So it's the same thing. All we're saying is that it can be used for that, but do not think that while wearing this mask, you're protecting yourself. When you wear it, you have to wear it for short periods of time because you have that in your face all day. I challenge you to not touch your face. We could film you and you'll see. It's very uncomfortable. Wear it for short periods. If you're ill, you take the metro, you don't want to contaminate anyone, that's when you put it on. My second question, we've talked a lot about the tests that we've been making in Quebec with people who are symptoms, but there's a village in Italy called the village of Vaud. The first death of the Italian pandemic took place there. They decided to test all 3,300 residents of that village, regardless whether they had symptoms or not. The result was that after the first round of testing, there were over 100 people who tested positive, and out of that number, there were 75% of people who were totally symptom-free. The fact of testing only people who have symptoms, does not limit the data that we could collect? Should we not test randomly, mandatorily in certain regions where there's more cases? Your question is very pertinent, and we ask ourselves that question, and we are planning doing that, but you have to look at one element. Today, where we're at compared to where we were at yesterday and where we're going. We had to, at the very beginning, with the quantity of tests that we had, which was limited, we had to use the test where it was most important to use it. So we knew that people who had caught the disease at the very beginning were people coming back from traveling. So we concentrated on that. Now, we have broadened it. We have 6 priorities. We've even broadened it to asymptomatic healthcare workers. And we'll do 2 things, like serological studies that will be able to identify what the proportion of Quebec people is affected, and also certain random tests in certain territories when we get there in terms of priorities. That's part of the strategies. They did it in that small village because they wanted to document that story, and we'll probably do it in Quebec, but also with serological studies to make sure at the end of the first wave, is it 30% of the population, 40, 50%, 60% have been affected and asymptomatic to help us better predict what will happen in the fall. In a second curve, a second wave, it'll depend. The more you spread it out, the more people are sick, and more there are people who are aversion from this virus, the more the peak can be higher the second time. What you want to avoid is, like in Italy, being submerged with people in intensive care. Testing strategies have evolved depending on the local epidemiology and our capacity.
D'abord, une question pour la ministre Danielle McCann. Il y a quelques jours, vous nous disiez...
A few days ago, Ms. McCann, you told us that you would present to us a state of the situation concerning the medication stock, so the medications that are at risk of, that we're at risk of seeing a shortage. Are you able to give us that list now? We're doing that work right now, so we are writing up that list. And I had told you last time that we were changing the way that we ordered medication, because before it was the establishments who would order directly from suppliers. Now we've centralized everything, and we are having a list of everything that is in each establishment, and we have a list of priority medication, amongst those the ones that we give for respiratory infections, also the ones that we give for sedation. So we are doing that work right now, and in fact, yes, we will, as soon as possible, present to you the state of the situation. We wish to make an order for Quebec, an important order of these medications, and we are preparing it right now. We are also in link with the different associations of suppliers of medication, as well as the Pan-Canadian Association of Medicine. And that is why, for the time being, I can't give you that information today, but I will be able to do it certainly within a short lapse of time. I have noted your request. We will be answering it, but we have to go through 1 or 2 extra steps to be able to present you with something that really shows what the reality is. Mr. Premier, yesterday you said that you counted on the judgment of police officers to give tickets. We saw that yesterday a lady whose birthday it was being saluted by people who were in their cars and went in front of her home just to mark her birthday. Do you consider that there's abuse, and do you think that there might be an abuse in the application of the rules? No, I trust the judgment of police officers. We asked police officers to be stricter, so it's not time to organize parties. whether they be outside or inside. So I think that police officers are doing excellent work, and I trust them.
Bonjour à vous. Ça s'adresse plutôt à Madame.
This is more for Ms. McCann. I would like to know whether there will be a recommendation, a clear guideline to allow people, the family members, to accompany a person who is at the end of their lives, because there's been very poignant testimonies lately, people who are going through a really hard time. Is there going to be a clear guideline about this? There's already been guidelines given about palliative care. It is, of course, very important, this situation. But even throughout palliative care, and I also heard about certain situations that were particularly difficult for families. And I have to tell you that in the guidelines that we've given, we are leaving room for the judgment in the different homes of palliative care or hospital centers. But I'm probably going to have a better look at the situation because, in fact, I have heard that there were particularly difficult situations for some families. I do trust the judgment of the different people who work in palliative care. I know that what we're doing a lot is, of course, we do not allow that there be many people who come and visit the person who's in palliative care. We allow, for example, one person at a time. So I think that this is going to remain as an orientation, but we really are going to have a look at everything to see whether it's applicable everywhere with good judgment, of course, depending on the situation. But what we're saying, generally speaking, in these situations, we have to open the door to at least one member of the family or close loved ones, particularly at the end of someone's life. I'd like to talk to you about the case of Sweden. Sweden is often given as an example in many domains. We inspire ourselves from Sweden, and right now it's one of the only countries that decided to not close down the schools, for example. They have some measures for social distancing, but they have not closed down any schools. For the time being, it's going relatively well. It's a kind of progressive immunity of the population. Have we ever thought about that? And why did we not make that decision and opted for something else? Is the question to me? Well, yes. Well, listen, I'll tell you one thing. The first thing, it is a possibility. We know. But we're facing a new virus here that hasn't touched a lot of people. So we're a virgin population facing this virus. And we have indications that this virus can bring significant consequences and stress the healthcare system to such an extent that we must start choosing between patients. And we know that our elderly are the most vulnerable. And it would probably be they, if ever we had let, getting a mass immunity that would have, normally vaccinated every person who would have survived. So we would have had a very high level of deaths in the elderly. In our Quebec values, our elderly who built our country are just as important as the younger ones. I wish to mention that. So that's strategy. Without my wanting to, judge what Sweden has done, because I'm not in Sweden, I don't know their distribution in age groups, but in Quebec, the value of health, even the health of somebody who is in terminal phase, who's only going to live another 2 years, is just as important as that of others. So we have decided to do it in this way. Now, are we going to be able to avoid every mortality in the elderly? No. And the proof is that we've had deaths, but we would have had even more so if we hadn't taken these measures. That is why we don't let visitors into homes for the elderly and in CHSLDs, because we do not want those people to die. Does that mean that we won't have, does that mean that we'll have another wave later? It's possible. Is it possible that later there will be clusters and mortality? The answer is yes. But we'll have gone through this very intense period where we would have put in peril our intensive care, people who would have needed a heart operation. So it's a populational choice, and I believe that certain countries that started like that, England comes to mind, well, they changed their mind because now they realize the impacts that this can have. It's still possible, but it is not the choice that corresponds to the value of Quebecers.
I
I was also curious to know what was going on in Sweden. I also believe that there's a difference between Quebec and Sweden because of Montreal. In Sweden, there's no 2 million people city. Their biggest city is Stockholm, and for having been there, there's no gathering where people are all stuck together. It's more spread out. So it's also a situation that is difficult, and we are looking at scenarios for tomorrow. And I think that if we wish to compare ourselves, we have to compare ourselves to countries that have large cities like Montreal and like Toronto.
Bonjour, Monsieur le Premier ministre. Bonjour à vous. Madame McCann, vous nous avez
Ms. McCann, you told us last week that for short-length interventions, there was a possibility that you would open up. And what we understand is in certain hospitals there are complications that they haven't opened. Have you been made aware of that, or has a message been sent to all administrators? Are you talking about surgeries, like semi-urgent? Yes. So we are starting today to have semi-urgent and semi-urgent interventions, including surgeries, in all hospital centers, followed by clinical committees. There are people who will be operated in those situations, and many, as you can imagine, in the oncology sector, people who are suffering from cancer. Of course, there are steps to be taken that are very rigorous, because first and foremost, the state of the person's health has to be evaluated, the risk in the present context has to be evaluated, and also we have to take into account the protective gear, medication, if the person needs intensive care or not, because of course, surgeries that don't need intensive care will be privileged. And I've heard that, for example, there will be no operations that last 7 or 8 hours. Yes, because we don't want to occupy an operation room for that long. But unless it is urgent. Of course, I repeat it, all urgent operations are being done. Very priority surgeries are being done and never stop being done. But semi-urgent, let's say that a woman has breast cancer. Of course, we are going to do the lumpectomy, but we're not necessarily going to do reconstructive surgery. So lumpectomy is about a 2-hour operation, whereas reconstruction can take 7 to 8 hours. So it's that kind of choice. The reconstruction can be done later because there is no impact on the woman's health. But in fact, we will do the lumpectomy because that's very important for that kind of situation. So I think that it is done with the greatest care, and there will be a certain volume that is going to be done this week. As far as the procedural mask, as N95, you told us last week, Dr. Arruda, that there was community transmission, particularly in Montreal, where we can see it with the numbers. Has the directive been given? Because that is what you said, that all the staff had to wear masks. Well, the guideline was given in the network. Yes, it was written, it was reminded of, and I can't guarantee, you understand that I'm here, and unfortunately I'm isolated. I don't even see my family or anything anymore. I can't guarantee to you that everybody received and understood it immediately. But the centers that do the screening and the places where they have COVID-19 are aware, and of course we're going to keep repeating and repeating and repeating, and if we hear that it's not understood, we'll make sure that we do it. I mean, I get all sorts of emails. My email address is very well known, and as soon as we have that information, we send it out and make sure that all managers are aware of it. And also, I want to tell you that we do systematic communication with all the establishments. They talk to CEOs every day, and those guidelines are given to everybody. Deputy ministers talk to all management teams and make sure that everybody has received the guidelines and apply them. So all managers, for example, managers every day see their teams and review the guidelines with them. I would like to know, you're going to be presenting to us scenarios tomorrow. At the beginning, you were recalcitrant to be able to do that, Mr. Premier, and then you said that you were going to present to us the most probable scenario, and more recently you said that you were going to show us a few scenarios. So why is it preferable for you to present us with a few? Well, when we speak with our experts, nobody feels like presenting scenarios, I'll tell you that honestly. Because the projections beyond the 30th of April, nobody wants to play at Jojo Savard or astrology, because that's pretty much what it becomes without meaning any insult. But other people have talked about scenarios, like Ontario that has a huge spectrum of data that people that are going to die, both very low, very high. We're trying to communicate to you is to answer to your appetite. So there's different methodologies, there's different projections that are being done, administratively speaking, to see how many beds we're going to need on such and such a date. There's analysts that are doing projections on the pace of the epidemiology as we know it right now, with hypotheses that are very varied, and those people don't want to even say when the peak is going to arrive, because the peak is probably going to arrive in Montreal way earlier than in Quebec. That's clear. So we are trying to put some order in all of that. And when we speak of scenarios, for some of them, the maximum number of deaths, minimum number of deaths, and the number of people in ICUs, for some, that's what scenarios are. For others, it's curves with projections in the future. So we're trying to, offer you the most interesting package of information at this stage. And also going forward, and with even just 5 more days, the comfort of my epidemiologists and the people arguing amongst themselves. And I'm not announcing it. We have to talk about the Premier. He'll decide. But we'll probably be able to announce things better, because people are even saying, Horacio, don't announce anything. They're going to chop off your head if you don't get the right number. But it's a kind of dynamic. And the expert, I understand, they're scientists. When I told you wearing the mask, it's like coughing in your elbow. I can't see, wearing your mask, you're done home. It's good. You're doing really well with that. Because we have to base ourselves on science. Science helps decision makers take good decisions. But I'll tell you very honestly, as of today, I have a small idea of what will be presented tomorrow, but it will depend, because once again, there's data that came here over the weekend that wasn't the same as last time, and I have to tell you that at best, if I could make my experts happy, is we don't say anything for the next week. But if we say that to you, you're going to kill us, so we'll give you some important elements. And what I'm giving you as a message, however, is really what my experts is telling me. Nobody wants to go beyond the 30th of April. Nobody. If we ask them the question, I'm going to have to, draw the curve myself, because they don't want to do it, and I understand them. I answered your question? Well, more or less. Oh, I'm sorry. Why do you think it's preferable to present us with many scenarios rather than the most probable one? Well, we're presenting many, because if we behave like Italy and Spain, that's what we'd look like. If we behaved, because we can say, all right, the worst scenario is the Spanish pandemic. And now we'll have numbers out, and all your hair is going to raise up on your head. So that means that we would be totally overwhelmed at this stage. Or we can give you scenarios explaining, if Quebec were like Italy and like Spain, this is where we'd be at. If we were like the best in Germany or other countries or Sweden, we'd be like this. But we think that we're going to be sort of like in the middle by being pessimistic. But in fact, in reality, as of today, we're below that. That's what we could express to you as such. But if you ask me what date is going to be the peak and all that, experts are scared. They don't want to tell you. And I understand them. Because for them, it has to be solid scientifically. And scenarios that were made in literally with hypothesis X comparing, even if you take the Italian numbers and this and that number, there's limits. Those numbers is what's in the web. It's not what's necessarily going on in reality. So there's many scenarios. And that's just to say, we'll see what the Premier will have decided and what will be suggested to us, as well as to say, if we were Italy and Spain, that's where we'd be as of today. If we were as good as other countries, like South Korea is a country where they welded down doors to prevent people from leaving. We didn't do that here. Quebecers accepted social distancing into democracy, and that's extraordinary. And I can tell you, I just want to pass the message. It's working, but we can't slacken. And the more that we keep things tight, when we get to the month of May and we'll be able to find a normal life, with coronavirus still, but not the same impacts. Does that answer your question better? Scenarios are a complicated thing. I mean, it rhymes with Horatio, but if I could do without them, I would. This is Dr. Arruda's team that will be making the scenarios. My only job will be to push them so that all the information be there, even that information which is not easy to give because there's a lot of uncertainties. So my role is not to write down the numbers, it's to push so that everything be there. Next question. Monsieur Legault, the U.S. president, wants to impose or wants to prevent the imports of masks in Canada and Quebec. Could he apply the same logic to the export of food products and food stuff that Quebec needs in the short term and perturb our food chain? Do you fear that scenario? No, because there is, in fact, a shortage of masks. There's a lack of masks everywhere in the world, but I don't think that there's any shortage of fruit and vegetables. So I do not think that he would fix a problem, because that problem does not exist in the U.S., you know, the fear of not having enough fruit and vegetables and food. Municipal employees right now, do they fear that they may be laid off because of the law that prevents municipalities from getting to a deficit? Are you thinking of loosening that act to avoid those layoffs in municipalities? Well, listen, each municipality is different. They have different collective agreements. They have a part of employees who have job safety, others who don't. There are places where they use municipal employees to go help community organizations. There are tax rates that are different. Loans where the rates are different from one municipality to another. What we want is to let municipalities have the autonomy to make the best choices with what they have in front of them, while knowing that most employees do have job safety. Monsieur Legault, you seem to be more positive at the beginning of the meeting, which is certainly encouraging for Quebecers. In light of the numbers, and you said that perhaps we were seeing the light at the end of the day, what do you mean by that, without revealing the scenarios? Well, yes, the scenarios you're going to see tomorrow, but when I look, I mean, for me what's important are the hospitalizations and the deaths. Of course, one comes before the other. Hospitalizations come before the death toll. So to see that we have an increase of only 8 in hospitalizations today is extraordinary. If we could have that for a few days, that would mean that we would get we would be getting closer to the peak. But I don't want to speculate here. It's just that the numbers today are encouraging. So much the better. We hope it'll continue. Next question from Ms. McCann. You said last week that we'd have enough ventilators. Could there be a lack, for example, of therapists, such as respiratory therapists? That's a very good question. I salute all our teams and our Deputy Minister at Hospital Affairs that takes care of having sufficient staff in order to be able to use the ventilators. So we have different strategies, but I can tell you today that we have what is needed, really. We know that we wish to add 800 ICU beds for those people who have COVID-19. Today, there's 164 that are being used, and we have some that are being transformed. We want to get to 800. And we do have the necessary ventilators, as you said. But as far as the staff is concerned, we are getting things organized, and we will be able to have enough staff to be able to operate the number of critical beds. If we have to have, like, for example, 800 ventilators that all have to be operated at once. Yesterday's announcement concerning the prolongation of the confinement measure, are you considering extending the list of essential services? with the principles that there may be things that we don't need for a week or two, but it's more difficult for a month and a half, or give derogations to certain regions where there's fewer cases. That's the first one. And the second, could you be more specific for the economic impact? I know that you talked about it, but I imagine that the Minister of Finance must have hypotheses on the impact on the GDP, etc. Well, for the time being, as we were talking about the scenarios on death rates and hospitalizations, we are also in scenarios concerning, well, we'll probably have, Friday. It'll be the first Friday, a full week of the month, so we'll have numbers on unemployment. So yes, the Finance Ministry is creating scenarios. It would be irresponsible not to. But when I ask the, Finance Minister if we're ready to make that public, I have an idea. I have an idea of the size of things and the scope of things. But this is a situation that is temporary. And what we need, first and foremost, is to see at what speed we can reopen businesses and stores. I am not excluding, once we have peaked with the agreement of Dr. Arruda, of course, I'm not excluding adding businesses into the essential services. I know, for example, right now, there are small businesses that feel aggrieved because there's big box stores that offer essential products as well as certain non-essential products, toasters or a hair dryer and things of that nature. So now we are in the balance of inconveniences. I understand that it's not fair, or it appears unfair, but at the same time, Quebecers, when they go get food in a big box store, it's useful for them to be able to take other elements which are also useful, which are perhaps not absolutely essential, but useful in their lives. So I'm aware that it's like the balance of inconvenience. It's inconvenient for small stores that big box stores offer other products, but there would be an inconvenience for Quebecers to close down those departments within big box store. So here I'm thinking more about the consumers. Could we add small businesses where you keep the 2-meter distance in the next few weeks? I'm not excluding it, but we have to have the doctor's agreement and make sure that we have passed the peak. So that's why it's so important to try to estimate when that will arrive, so that we'll know when we start going in the descending part, and then we can start opening the door to certain businesses. So yes, we are looking at it. Mr. Premier, if you'll allow me, we'll probably be able to open many things, but with different conditions. Social distancing has to be present. We still have to protect our cashiers with plexiglass. Those kinds of elements that are going to allow us to continue without putting in peril an increase, a secondary increase of the infections. So it's going to be per sector to say, okay, well, here you can reopen, but you have to respect the following. So then I think that we could go back to a certain normality, but never like before. And I'm convinced that there are practices that have been set up now that will continue in the years to come, particularly during flu season. It is surprising how much it really went down as soon as we put distancing. Don't worry, we're not going to put Quebec on pause for years, but we're learning things. That when you're sick, don't go see your grandparents. It really decreases hospitalizations. Don't go to emergency ward if it's not necessary. Those are all things that we'll have learned collectively. I would also like to add a few words on the ventilators. We have enough ventilators to cover the period that would be the most pessimistic of scenarios. It's true that there's a challenge of operating said ventilators, of having the respiratory therapist. And I want to tell you, Daniel is going to laugh, but a vet cannot care for a patient, but they know how to use a ventilator. So we're very creative right now to be ready for the worst. I just want to tell you that. We are very lucky in Quebec to have so many ventilators. I know a lot of our neighbors who don't have enough to cover the peak, and we have enough. Do we have enough respiratory therapists to make them function? Well, we're in the midst of training and, if necessary, bringing a few veterinaries who know how to use the machine, and they know how to operate the machine. Not the patient, but the machine. That's not being excluded. Well, speaking of our neighbors, Doug Ford this morning in an interview on television spoke about 3 million masks destined to Canada, cargo that had been blocked over the weekend. Mr. Trudeau is a little bit more diplomatic, talking about delivery delays. Are there deliveries of masks or other PPEs destined to Quebec that were not able to enter in the past few days following the announcement of the President of the U.S.? I did speak with Mr. Ford this morning. They are experiencing a situation that is tighter than ours right now. Anyway, I'll let him talk about the number of days. But over the weekend, we got a load from Mexico that was very welcome for our needs in Quebec. I know that there are loads for the federal government that are going to be distributed, and those have been delayed. However, I must say, I am happy to see that the federal government is taking into account the needs. Right now, there are 2 provinces, because of the big cities, Toronto and Montreal, that have more needs when you look at it proportionally. And the federal government is taking that into account in the distribution of masks. But, I mean, we're tight here, they're tight in Ontario, and yes, it is sometimes difficult to get all the deliveries. This completes our French questions. We will now go to English questions.
Good afternoon. I have, Mr. Arruda, I have the impression that basically what you think and what Premier Legault thinks about the projections tomorrow, I have the impression that you don't like it at all. It's going to be a long night, and it's damn if you do, damn if you don't. But for you, Premier, it's more a question of giving this information, and you have the impression that Quebecers will take these numbers and react well. I have the impression that there is like a clash between you two regarding the projections tomorrow.
There is no clash at all, I can say. I know that he's asking for good questions that I would like, as a scientific person, give him the right number. Even my staff or the people working with us are always afraid to say a number because there is too much margin of minimum and maximum, and we are still in a place where projections could be projections. And as we are rigorous persons, telling that number that will be print and that day Dr. Arruda or this expert did that will be challenged. But I think it's normal that people want to have information. We will give the best we can with, I would say, the cautions that we want to say about it. So it's not because I want to, first of all, my only thing I think is important is to really make what is good to do at the right time, at the right moment. We were very early in the epidemic to do those social distancing issues, closing. For me, that's the action, the treatment I'm giving. What is going to happen tomorrow is I'm looking at it, but it's not my perfect focus, actually. But we will do it. The boss is asking it, is the Prime Minister. We will give him the best information. But we don't want to give him something which is not enough scientific. Okay? And I'm forcing my people to project, to accept it. Okay? So we will do that. Is the big boss is taking the good decisions? We just want to give him the right scenarios. And I'm in between Premier Legault, our scientific people, the population, the media, and don't think I'm against scenarios. That's not the case. It's just because it's not an easy question. And I don't want to also give numbers just for giving numbers. That's the case.
Okay. I had this situation before in my life. When I was president of Air Transat, preparing budget for the next year, I used to have this kind of answer saying, hey, how do you want me to have a forecast for the next 12 months about our revenues or about our expenses? But it's better for me to have a forecast that is not perfect than not to have any forecast. But I can understand that it's not easy for Dr. Arruda and his team to commit on different scenarios, not knowing perfectly what will happen in the next few weeks. So I can understand. But I think my job as a Premier of Quebec, if we want to be prepared for the worst scenario, we need to know where it can go in the next weeks and months.
Second question.
Mr. Arruda or Mrs. McCann, when Dr. Tam said earlier today that she is giving this advice to people to wear a mask in public spaces where distancing may be difficult, public transit is an example, she's referring to pre-symptomatic or asymptomatic carriers, that there are many. We don't know exactly how many. So that may be a trick, but then she has the same type of, she wants people to take precautions. So are we going to see more masks in Quebec worn by different people?
May I?
Yes.
Yes. Okay. Yes. So first of all, I'm part of the CCMOH of Canada, so we are working with Dr. Tam, which is at the Agency of Canada. So we are working. I've got the draft here, okay? He has been so... what I want to say is that it didn't change my position at all, and I didn't say that it's not good at all. I just want to make sure. It's very important to understand that the proven things are staying home as much as possible, physical distancing, washing your hands, washing your hands, washing your hands. Even if you get a mask, you wash your hands. Protecting the most vulnerable from infection and exposure to others, and covering your cough with tissue or your sleeves. When you're going to put the masks for the surgical masks are for healthcare workers, not for everybody in the city. If you have a mask, it's not for protecting yourself. It's for protecting others, like if you use a tissue, sneeze it, put it out, wash your hands, wash your hands, and wash your hands. And then what you do, then if you have a mask, you're going to not spill it to others, but be careful. If you have a mask, you touch it, you take it away, put that down, contaminate it, put it in your eyes, you're not helping yourself, okay? If you're sick, you're already sick. But for the ones who think they're going to be protected by the mask, that's not the case. So it's like you can do it, especially if social distancing is not possible for a short period of time. It's almost very difficult to have a mask all the day. If you want to be a champion, do it, and you're going to be in records of, I don't know, the book of the records. So what I want to tell you is that if you want to keep it and go, you're sick, it's another way to do it. But don't think that it's going to protect you from others' infection. It must be very tight. You must have a good tissue. If it's humid, it's not working anymore. So I won't say don't use it, but be careful of not thinking it's protecting you. It's good for protecting others, and be careful for not touching everything. And because of your mask, you're gonna be infected. So it's what I'm saying. I'm not against. I'm signing and authorizing this position, but I want just people to understand what does it mean.
Thank you. So we need to accelerate. Samuel Pouliot, CTV.
Hi. Mr. Legault, according to Google, the vast majority of Quebecers are respecting physical distancing rules. But on Saturday in Montreal, there was a lot of people who were close to each other. There was the police giving some fines to people. What message do you have to Quebecers as the weather starts warming up?
The message I have for Quebecers is it's a question of respect. The vast majority of Quebecers respect the directives that we've asked them to follow. So please, the minority not respecting that may have very bad impact on the number of deaths. So I think it's a question of respecting your neighbors, respecting everybody. It's serious.
And le regroupement des sages-femmes du Québec is asking you to take a clear position against the Jewish General Hospital. Their decision to prevent partners of attending birth. There's a petition online calling for an end to the ban. And last week, the governor of New York overturned a similar decision of an hospital in their state. Will you do the same here and overturn the decision of the hospital?
Okay. I think that with the great number of cases at the Jewish hospital, I think it's a good decision to have nobody with women that are coming to deliver. But we offer all those women to go to another hospital. And it's the only hospital in Quebec where we have this directive. So I think it's fair and it's reasonable.
Thank you very much. So we'll switch to questions sent by email. The first one is from Raquel Fletcher, Global News. Some companies like gyms, for instance, continue to take money from people even though they're closed. Can the government force companies who are closed to stop taking monthly payments?
We would need to see that one by one, but for me, it's not a priority right now to look at those situations.
Okay, and will the National Assembly stay closed past April 21st, or are you looking at a type of virtual assembly like what Mr. Trudeau suggested for Ottawa?
It will be part of the discussions. I've got a phone conference call this afternoon with the three chiefs of the opposition, and it'll be part of the discussion.
All right, and now a question from Phil Autier, Montreal Gazette. We are getting calls from families with parents in CHSLD who wants to move a parent or grandparent out of the center. Under the rules, they will lose their rooms. Is there any flexibility to this policy?
Well, it's a delicate operation, right, to bring a parent out of a long-term facility, and there are other conditions like that the person is not in a long-term facility where there is an éclosion. There are cases of COVID-19 and other conditions too. There is a very big demand of places in long-term facilities, and what we've mentioned also is that if you take your parent or your family member to your home, it has to be for the time of the pandemic. So it could be for a long time. So it's I think we're choosing the best option is to give the opportunity to somebody else who needs a room in a long-term facility in the meantime, because the time of the pandemic might be long. So I know it's it's not easy to make that decision, but unfortunately I think we have to go that way to give really the opportunity for other people who need it to have the room.
Thank you. And again, I think you already answered, but concerning the Jewish General Hospital, just to make it clear, you're not planning are you planning to review this policy or extend it to other hospitals to make the policy universal for all concerning women that are upset with the no partner rule in the maternity ward?
Well, I think we need, as the Prime Minister said, we need to be very clear that this is only at the Jewish General Hospital. So in all the rest of Quebec, in all the other hospitals, people can be accompanied by the partner or somebody else, of course, under conditions that they're not symptomatic, they haven't been in contact with somebody who is symptomatic. Take all the precautions because, of course, we have to be very protective of the rest of the people, especially in the hospital and the staff. So what we're saying today is all across Quebec, it's the same policy as before. The Jewish General has a special situation. That's where we have the most COVID-19 cases, for instance. So I think it's going to remain like this.
Well, thank you very much. Merci tout le monde. Merci pour votre disponibilité et à demain.
Merci.
À demain.
Demain.